Kenya has been dealing and, of course, battling, with a high burden of cancer, in the last 20, 25 years. Are you convinced that the policies that the government is putting in place is helping to alleviate the suffering of cancer patients in Kenya?
Thank you so much, O'Brien, for that question. And we would look at the policies in two tiers. So one of the policies that is guided right now by the National Cancer Institute, looking at the National Cancer Control Strategy that is currently on ground. Mm-hmm. So the government really tries to come up with solutions, especially on what Dr. Michelle mentioned on late diagnosis. That is why Kenyans are dying. That is why we are having those statistics, because we are diagnosing cancer very late. And what the government has tried, one of the things to appreciate is on formulation of the universal health coverage. Mm-hmm. So universal health coverage was now under the SHA authority. It was supposed to help with early diagnosis. It was supposed to help with early screening and all that. So they're really trying to try and find out or avenues and ways of having cancer diagnosed early. They're really trying to look at the prevention, look at the efforts right now, for example, for the cervical cancer. We have the human papilloma virus vaccine that is currently rolled out. So for the civil society, we look at why is it that the government has rolled it out and yet the uptake is still low. So we come in by bridging that gap by doing awareness and sensitization. Because you can imagine somebody coming to save the girls from getting cervical cancer in future, which is the #1 leading cause of death among these cancers in women. So that is one way that
cervical cancer.
Cervical cancer, it is the #1.
It's not breast, prostate?
No, breast is in terms of incidence. So the numbers are breast, but the mortality is cervix. And this is one of the cancers that can be prevented. So of course, government has tried to roll out that one, and there's still low uptake. And as of this year, was it May? They now, because they used to do a double dose. So a girl will go between 10 to 14 years, will go at maybe 1, and then they go back after 6 months. Right now, they're doing a single dose. So those are some of the efforts that the government is doing. And another one that we have to mention on universal health coverage, it's really beautiful on paper and it is well done. But now we are trying to see, we are looking at it 1 year later, and we're currently looking at especially the universal health coverage 1 year later. Where are we? What can we improve? How has it been? Are the patients getting help? Is it helping to improve, especially on the late diagnosis? Is there survivorship support? Is there palliative support? Is there rehabilitative support? So those are some of the ways. And of course now, what is also working is with the counties, because health currently is devolved. Each and every county, the comprehensive cancer centers, the government is trying to put comprehensive cancer centers in all the counties. But again, we are coming to say that it should not just be a center, it should be a fully placed center with oncologists, with the equipment, with the laboratories, with everything that the patient needs, so that a patient from Narok does not have to come all the way to Nairobi to access cancer services at Kenyatta National Hospital, and yet they could access it near their homes or near their regions. So those are some of the initiatives that we feel that the government is trying. Though we are not yet there, it is still #3 leading cause of death, but we feel it is trying to improve the situation. Yeah.
You talk about the government